Hello, Dr. Tobias. How are you?
Hi, good, and you?
I'm doing great. Again, we're in the IDS and pretty busy place, it seems.
It is, yes.
What's your experience with the IDS? Like, how many times have you been here? And
Oh, I
yeah,
think it's my fifth time.
fifth time.
Yeah, it's my fifth time. But I think this year it's much fuller than the last years. I think.
I see.
But I don't know, maybe it's because it's 2 years ago, so maybe I cannot remember right. But it's
Yeah.
it's very full.
Well, this is the last time I say it. This is my first time here.
Oh, okay.
In every podcast, I've been saying this is my first time. So probably anyone listening to the podcast will be like, "We get it." But yeah, and I imagined it would be this busy, it would be this big,
Yes.
but I did not imagine to be like this is this is quite big. It's much
It's
bigger than you would
very
expect.
big, yes.
Exactly.
It's impressive.
It's very impressive.
Yes.
So when you visit the IDS,
Yes.
what do you look for? What
I think-
technologies you look for? Yeah.
I'm very interested in new technologies, so that's where I take a look before I go here. It's like which manufacturer has new ideas. What's very interesting for us orthodontists is graphy. I don't know if you know this.
What?
Graphy.
Graphene?
Graphy is a special material for
Carbon,
aligners.
right? Oh, okay, yeah.
So that's very interesting.
And can you tell me a little bit more about it?
About graphene?
Yeah, obviously, yeah.
So graphy is designed to. So when you do an aligner, when you manufacture it, you have to do a cast, and
Yeah.
on the cast you have to push a foil. So
Yeah.
and then you make the aligner out of this foil.
Yeah.
And graphy is for that you can print the aligner directly. You don't have to have a cast.
I see.
So that's very
It's
interesting.
very interesting.
Yes.
And I think your lecture was a bit different from that
Yes.
topic, right? Like
It
your
was not
lecture.
about graphic.
Well, it was not there. So I heard a little bit of the lecture.
Yes.
And it was about multifunctional appliances, right? Can you explain what are these devices to
Okay.
maybe general dentists?
Sure. It's so when you are an orthodontist, you deal daily with sagittal anomalies. Sagittal means that you have not in this way you have not the right occlusion.
I
So
see.
either the lower jaw is too much forward or it's too much backward.
I see.
And when you have the multi-FA, you can correct it by using this appliance in combination with intermaxillary elastics.
I see.
So that's what you do. You do a movement to the posterior position so that the teeth are in the right position.
I see. And how are they different as devices from other technologies? Like let's say like now the pop thing is
So,
clear aligners, for
yes.
example.
Yeah. Oh, when you compare it to the aligners, it's like when you do aligners, you have some biomechanical difficulties. So aligners are not able to do everything. Let's say if you want to distalize the upper jaw or the upper lateral teeth for more than 4 millimeters, then it's very hard to do it only by aligners. And then you need to have additional appliances. For example, the multi-FA.
I see. And are these devices or the techniques that you can apply using these appliances, are they to be used by, for example, general dentists, or it's better to only be utilized by specialized orthodontists?
Oh, I am a specialist orthodontist.
Obviously,
so
yes.
I have to say that,
Don't use it
that
unless
should-
you're an
you only
specialist.
should do it when you're a specialist orthodontist. Because I think that's our daily business. So I know what I'm doing. I do not do crowns because I don't know how to do that.
Yeah.
Right? It was 10 years ago when I did my last crown. So that's why I do orthodontist. And I think if you want for your patient a good treatment, you should do what you can do best.
I see. And how do you see now with digital dentistry, how did the orthodontic treatments develop? Like, let's say, like you said, in the last 10 years, you
Yeah.
haven't worked with crowns, but you've obviously been working in a lot of ortho.
Yeah, it's big time for digitalizing at the moment. So in my office, in my practice, we only use scans. We do not do
Conventional
impressions.
Yeah, conventional.
Yeah, that's we don't do it any longer because the children don't like it, and it's better for our
maybe workflow.
management.
Oh, management
Yeah?
also.
So I don't need the models of the patients in the
I don't know.
I don't need to store it somewhere. I just can have it. I have them digitally.
The data
right?
on the makes sense.
And we bought a 3D printer half a year ago, so I can do many things without having a person that does it, because the 3D printer doesn't. For example, casts.
I see. And does planning and, for example, giving the patient an idea of how the treatment will go
Yes.
is
Yes.
also, one
Yeah,
of the,
you can do this based on KI or AI.
Yeah.
You can say, that's how you look, and that's how you can look if you do the treatment. That's very good, but I have to say that it's not perfect, because
it doesn't
sometimes-
always.
Yeah, it's not sometimes meeting with the rules of orthodontics, let's say. So sometimes you say, oh yeah, that looks nice, but it's not possible to do this, right?
Okay.
Yes.
And what are the challenges that you see you're still facing in orthodontics right now, and that you look forward for them to be solved in the future, for example?
Okay, especially in Germany, I think we have some trouble with health insurance.
Health insurance.
Yes, there's something. I think it's something special in Germany, because you have more and more paper load, and you earn fewer and fewer, less and less. That's one problem that we are faced with at the moment, and I think there are some problems that never change. For example, the ability of children to be compliant. You know what I mean? It's like when I say you have to do this because you want great teeth, some of them do this,
Some
and
of them
some just don't. So,
But that's
and that will not change. That was 20 years ago, and that will be in 20 years again.
we can't help maybe that.
That's it.
Okay, so maybe this is as a last point to leave our audience with. One thing that you would have people keep in mind when listening to this podcast or hearing your lecture about dealing with ortho patients, what would be something that you could give them, like a takeaway
From the lecture?
from the lectures, or generally speaking, like something that if a dentist is dealing with an orthodontic patient should always keep in mind?
I think you should always keep in mind that you do the best for your patient and not the best for yourself. It's like we really try to do this in our office. So it's like, if the patient does, I don't want to be treated like this, then we try to find a solution. It's not always possible, but I think that's very important to do a good job.
I see. Well, thank you very much.
Thank you.
Appreciate you. This is the last podcast of the day, of the
Okay.
whole time. So, yes, thank you very much for being here, and we'll see you in another episodes. Yeah, thank you very much.
Thank you very much.